Dr. Lahita, as we are in the critical care unit here
Yes.
at St. Joe's, as we've been talking about lupus, one of the things that strikes me, and we can help folks understand this, is can you live and live well if you have lupus? And if so, how?
40 years ago, you couldn't live well with lupus because we didn't have the right medications. Today, we use medications in a different way. We can diagnose it earlier. Years ago, when I was a medical student, lupus was a death sentence to many people. Today, it's very rare to lose a patient with lupus. We get the patients early on, we treat them early on, we prevent mortality, which is death, and morbidity, which is the extent of disease. We like to have patients early because here at St. Joseph's University Hospital, we can treat them early, we can control the disease, and we know the markers serologically, that means in the blood, to see when the disease is active and when the disease is not active. There is such a thing with lupus called a flare. Every patient with lupus is allowed to have 6 flares a year. That's what I expect. But with good therapy, we prevent those flares because when every flare happens, and that's fever, muscle aches, joint pain, destruction of tissue, etc., your disease flares up like a flame. And we control that. But we need to make the diagnosis early. We need to follow the patient very assiduously, such as monthly visits, and then we can control the disease and you can live a normal life.